Kegel exercises, a huge topic. You must have heard about them. You might even have already started doing them. And regardless whether you have heard about them or not, whether you have been training or not, I hope I will be able to share with you something that I learned from my personal experience through the years on my way to overcoming PE. I will not go a lot into details of what it is. You can find hundreds of YouTube videos and articles on the internet about it. But generally speaking, this is the area between your legs, your perineum muscles. They must be in tone. In most cases, quite often, just because we are not used to, we are not trained to pay attention to that area, we never do anything with them apart from squeezing when we finish peeing. And that's not enough. Not enough in the same way as if you compare walking, which is beneficial, to running, which is far, far more beneficial for your health. And why it is so important, why there are so many talks about Kegel exercises. You see, when your perineum muscles are in bad shape because you have never trained them, they become weak. There is not enough blood supply to that area. And weak muscles tend to be more cramped. Also, because they are weak, whenever there is an urge, when you come to a point of no return or approach that point, your muscles immediately get squeezed, immediately, just because they don't have any power to be relaxed, to enjoy, and be confident, so to speak, that they can sustain the pressure. So that's why they just get cramped, get squeezed as soon as there is any tension, as soon as there is any urge to come. And again, this prevents you from lasting longer and staying in relaxed position, in relaxed state. Now, I hope that that gives some clarity in terms of why you need to do Kegel exercises and how to do them. You can start with a very simple approach. Might be not as simple, but the most direct approach. The approach of stopping urination. So next time when you go to pee, just around middle or at any point before you actually finish urinating, try to squeeze your perineal area. Try to stop the urination. Stop for a second or two and then continue. This may be a little difficult at the beginning, but with enough determination and practice, it will come. There is no specific advice here, just because it's a matter of persistent trying, and that persistency creates neuro-muscle connection that in the end would allow you to stop and control that muscle that stops the urination. So this is a step one. Stop your urination for 1-2 seconds and continue. You need to aim to be able to do this stopping 2 or 3 times during each of your urination. And with time, you will see that it will be getting easier and easier. Now, the next step would be for you to do the actual squeezes. Here again, there is a lot of information which you can find on internet. I would give you the most basic and important aspects here. Try to just squeeze your whole perineal area, your whole lower area, as much as you can. Preferably do it or start doing it while you are seated. At the beginning, you will have to squeeze your whole butt and even your belly, because again, there is no neuromuscular connection. But with time, you will be able to gain more and more control, get more and more awareness about perineal area, and it will be getting easier and easier. Your goal is to isolate the perineal muscles so that your glutes and your belly muscles would not be engaged whenever you do the squeezes. So again, here you just need to keep trying and doing it whenever there is a chance. Now, when you should do it, the best way is to create a routine. Find something that you do every day and try to incorporate this practice into that activity. For example, you can start practicing Kegels while you are brushing your teeth. So just set yourself that as soon as I step into bathroom, take my brush and start brushing my teeth, I do simultaneously squeezes. Another occasion might be driving to work, for example, and not even necessarily driving, but while you're on a train or a bus, you can also dedicate that time to doing the exercises. So the idea here is to find something that you do every day and connect that activity with your practice. Otherwise, your mind will keep forgetting about it, and you'll just waste time. And here, because this is so important exercise for men's health overall, not necessarily only for premature ejaculation, the sooner you start doing them, the better. And you also need to set yourself in the right mood and be determined enough to keep working on it. You see, it's not quick fix. You may not see immediate results, and definitely you would need to dedicate at least 4 or even 6 months before you can see the results. So this is kind of a warning for you, so that you prepare yourself. If after a couple of months of the training you don't see any improvement in your lasting time, it doesn't mean that the exercises don't work. They just need more time. Be ready for it. Your right mindset and determination will get you results.